from this is not necessarily a SIBO the main cause, but it's a part of the picture. And unless we get that taken care of, and this is where Lyme comes into, that it's really hard to fully heal. So that's why, I really think it's important for a majority of people to do the breath test, see where you are at, see if it's hydrogen or methane producing, and then be treated accordingly. Fibromyalgia, they're finding SIBO in 93% of fibromyalgia patients. Irritable bowel syndrome, it's reported up to 78%. Diabetes, something that you're probably not even thinking would be connected to the gut as much, they're finding it in up to 40% of diabetics also have SIBO that's going undiagnosed and treated. So this is sort of our approach for SIBO, so sort of how we go about it. So we sort of look at the symptoms and see if it fits with SIBO. If you're having, the gas and bloating, diarrhea, constipation, or malabsorption. Sometimes what we see is that we're just seeing lots of signs and symptoms that go with malabsorption. So they're sort of fitting the picture. We also then will go through and do the test. And from there, what we find is that it really does have to be a twofold approach. So we go after and do the right herbals or antibiotics, and then also put in any dietary restrictions. We do different diets with different individuals. FODMAP, which is up there, so where it says better on FODMAP, paleo, or Whole30. FODMAP is going at specific sort of carbohydrates and fermented foods, and that there's lots of information you can find about FODMAP. But sometimes putting people at the beginning on FODMAP so that there's not more inflammation. I also find sometimes that certain individuals, if they're bigger histamine producers, so if they have more of those histamine response, sort of allergies all year round, or runny nose, or if they get hives easily, sometimes I'll put them on a low histamine diet and do more of like a low histamine paleo. So I tend to do the diet specific to the person. If they don't seem that they're that sensitive to food, we've had really good success going to a paleo or Whole30 diet, which is a little bit easier to follow, a little bit clearer cut than FODMAP. So we use sort of different diets for different individuals depending on signs and symptoms and other things that we pick up through the clinical assessment. And so what we do then is really find out if they fit into this category and where they fit into, and then if they're a good candidate for the test. One of the things I'll see too is that, we're talking obviously about this because of the Lyme disease, and that we do see that as a co-infection and co-concern. But I also see a lot of people come in that have, chronic food sensitivities, food allergies, or they go from one sensitivity to another. They come in with a list of 40 foods that they've been tested and they have to avoid. And then, they follow that for a year and come back and there's 10 other foods. A lot of times that's because there is an imbalance in the gut, and that leads to you starting to respond and your immune system responding to the food, because 70% of your immune system's in your gut. And that we then have to fix the problem, not just keep taking you off foods. So one of the major things I see is people that come in, a lot of times food sensitivities are signs and symptoms, not the primary. And so that's where it's important for us to sort of put that whole picture together. So what this shows is that one of the things that sort of deciphers SIBO from this is that we will start to see more joint pain because of the malabsorption and the body just being depleted and deprived. So one of the things that separates this from just a lack of good bacteria or like a yeast or candida is that it tends to affect the whole body. And so it really does tend to be that great imitator that we talked about before. So the test that we do, so at Stillwater Natural Medicine, Dr. Bush, I would say now his passion is SIBO. For the patients that have seen him, he keeps up on everything when it comes to SIBO. He's very passionate about SIBO. And because of that, he does in-office testing now, which is great that he's brought that to Minnesota. So, and I do believe that he's the only person that does in-office testing in Minnesota. And so he offers that to his patients for a discounted price, so they don't have to pay as much, and then they get instant results, and they can get the reading right there. Once a month he does it in office, or you can come pick it up and drop it off and get the results faster. So there are two ways that we can test for SIBO. We can use glucose and we can use lactulose. So lactulose is the one that needs a prescription because it's a actual compounded sugar that is synthetic, so it needs a prescription to be able to write it. By far, the majority of testing uses lactulose because we will actually see not as many false positives. We get a better specificity so that we can really look to see if it's truly SIBO when it comes to lactulose. But there are times if people can't tolerate the lactulose, or sometimes if we're shipping it out because of the prescription, that we'll use glucose, and we still get really good results with glucose. So what you do is you drink the drink, so you drink the glucose or the lactulose, and then there are tubes that you breathe into. What happens then is the tubes collect the air, you send it off to either Stillwater Natural Medicine, or there's a couple labs that we still use far away with some of our patients. But what they do then is that they'll test the tubes for 2 to 3 hours to see if there's a rise in the hydrogen or methane gases. And so then we can see whether or not there is a possibility of either these methane producers or hydrogen producers, and then we can treat accordingly. So there's also a couple different ways that we look at whether or not it's a positive. So for glucose, a rise over that first reading of 12 parts. So if the hydrogen goes up over 12 parts, then we know it's a positive. Or if there's a spike. So everybody's different with their readings. Some people will start out, that first reading will start out really high, and then we know they're positive because they're immediately starting to produce these gases. Some people will have a spike an hour into it. Some people will spike right away and stay up. So we sort of take a look then so that we can get an idea too of how these critters sort of work and how it is best for us to go after it. So those are just the criteria for what we use to diagnose it and then to know how to treat it. So these are the different treatment options when it comes to SIBO. We can use, like I said, that FODMAP or specific carbohydrate diet, where we then take out any foods that would be potentially feeding it. And so we go about it through the diet. There's also an elemental diet, which is actually, you can either buy pre-made elemental diets or you can make it at home. So there are recipes to make it at home. And all you eat are these sort of branched amino acids. So it gives your fuel or your gut the fuel that it needs without feeding it. So, and this one, the elemental diet actually will start to take the bacteria away without even doing herbs or antibiotics, but it's a very, very strict diet and not so fun. So a lot of people choose the FODMAP with the herbs or antibiotics. And then we'll use a regimen of herbal antibiotics and antibiotics. So herbal antibiotics that we use, berberine and oregano by far are the two that we use the most in conjunction with each other. And actually in research, they've been shown to be as effective as the antibiotic rifaximin, so the happy little gut that walks around on your TV. That's the one that we use for SIBO. And we can also use herbs to get good results. We sandwich our treatment in between herbs. We do herbs, antibiotics, and then herbs again. And the reason why is the rifaximin has, the FDA is very specific and protective of rifaximin. And so it's a Cadillac of the antibiotics, so it's very expensive. And so, and a lot of times they won't cover it. So, and if they do, they only cover it for 14 days, even though the majority of research says 21. So what we do then is we utilize the herbs first for some die-off and to get after the infection. Then we use the antibiotics if necessary, and then we finish off with some herbs too, so that we can have the most success possible when it comes to getting SIBO and taking care of it. So we can use other herbs besides oregano and berberine, but those are by far the two most common. And then we sort of rotate the patient and treat them sort of dependent on what their results are from that breath test. And then this are the antibiotics and how we go about with the antibiotics. So research by far shows Rifaximin is the best. The reason why is it works a little bit different. So instead of another antibiotic like a broad spectrum, like a Cipro or penicillin or Z-Pak, those are all broad spectrum. So what happens is you take that antibiotic and it goes throughout the whole body. What Rifaximin does is it's resistant to the breakdown in the stomach. And so instead of then going through the whole body, it'll actually get into the small intestine and sit there so that it'll go after the infection. So that's why it's so powerful for SIBO. And it's actually pretty gentle because what we find too is that we do get some die-off with it, but we don't see that it necessarily has huge side effects. I haven't seen anybody that's really reacted incredibly terrible to Rifaximin, which is nice because it just has more of an effect in the small intestine, so you're not dealing with some of those side effects of broad spectrum. And then neomycin, we'll sometimes put neomycin or flagyllin, depending on what we find again, and we base it specific on your methane and hydrogen. So we go after specifically what we find. So this just tells you a little bit more about Rifaximin and why we use it. There's a lot of great research out there. You know, I've worked even with a lot of gastroenterologists in the area with SIBO and my SIBO patients. And this is even something, I always say this, you know, but in my line of work, I definitely have maybe some voodoo that people will look down on and say that it's more voodoo. This is nothing like that at all. This is, you know, if you want something that's research-based and, you know, tried and true in the research, that, you know, the Rifaximin, there's tons and tons of information out there. So even the traditional doctors will look at this and see the research and know that it's tried and tested in their world of evidence-based practice. So, so there was a research of 32 studies, so a total of 1,331 patients, and it showed a 70.8 effective, 70.8% effective in eradicating SIBO. So that shows you, you know, anytime we do research and see that 70%, that's a really good outcome. So Rifaximin is very effective for SIBO. And the other thing that's nice about that is you'll see the 4.6% of adverse reactions. So again, we're not seeing, you know, a lot of side effects from using Rifaximin, and we're getting really good results. And then there's some other things that we will use specific to Rifaximin. Sometimes using something called guar gum, which is a cooking agent, but what it is it's an actual gum. So it is a binder that's used in a lot of food, but there's a lot of good information about hydrolyzed guar gum and its effectiveness using it with Rifaximin. One of the reasons I think that this is, you know, just sort of putting it together with physiology is that if we think about the small intestine where these bugs are hanging out, there's a lot of nooks and crannies. So that's the long, windy tube right behind our belly button, and it looks just like that little critter that walks around on TV. That is a small intestine. So, but inside of it, there's all these little nooks and crannies, and they're there for absorption. So as food goes through, we can take out all the nutrients. What guar gum does, and why I think it has a good effect with Rifaximin, is that it's a binder, so it's like a magnet. So if you take the guar gum, what happens then is that, and it feeds. So the little bugs love this, you know, thick binder. So what I think it does is it goes in there, and the guar gum will feed the SIBO, but then if you take the Rifaximin with it, then you've sort of attracted it all to that guar gum, and you can knock it out. So I do see that using Rifaximin with the guar gum does give a better effect, and research shows that it can increase its effectiveness to 87.1%. So we can go from about 70 to 87 with Gorgum, which, is a good increase. And then also we have to make sure to put in those good microbiome. So it's really, really important that we replenish the microbiome, because that's what's going to really make it so that SIBO and the body can fight everything off and be at optimal health and wellness. So we also look then at the probiotics and replenishing those. These are some of the other antibiotic treatments that we use. So you can see there's a couple different things that are out there and different ways to go about it depending on what's going on. The other thing about SIBO that's important is that a lot of times with SIBO, we'll see that there's a motility issue. So what we also have to do is make sure that we're supporting that component of it and getting the gut back working again and into, what I was talking about before, a thriving gut, so that the whole body, immune system, brain, everything else can thrive too. So anytime that we're using herbs or antibiotics, there are some other things that we want to be cautious about. We want to make sure that we're supporting the body so that there doesn't become another co-infection called C. diff or Clostridium difficile. And so we use a specific probiotic called Saccharomyces boulardii to make sure that that doesn't happen. And then we make sure to really replenish the bacteria. So one of the things that I make sure with all my patients is that we're not just going after the infection, but going after rebalancing, that we're going after getting that gut back to its optimal function and optimal state. So, and then also the reason we do the herbs, antibiotic and herbs, is to increase the effectiveness of treatment, but also to make sure that we're not getting into a resistant antibiotic state. So if anybody is interested in doing the test, or if anyone does the test, there is some prep. So there's some pre-test prep that we give for information. What we do is we sort of take you off of anything that could interfere. We want to get a good picture of if there are bacteria in the small intestine. So we take you off any antibiotics or antifungals that you might be on. We have you avoid any laxatives just a couple days ahead, because we want to not test it when everything's going through your gut, but to let it sit there and see if there is actually bacteria and the byproducts of that bacteria in your gut. And then we have everybody right before if you are a smoker, to avoid it, or don't be exposed to secondhand smoke 1 hour before, and to also avoid the vigorous exercise for 1 hour before, so that that doesn't interfere with killing off the gut bacteria before we test it. And then the prep diet, what we do is that we try to get it at a time. Not all patients can we do this with, but optimally we try to make sure that you're not constipated or have loose stools. But again, not everybody can reach that goal, and that's okay. We have you fast before so that we can get a true reading, and then we give you that glucose and lactulose and feed it and see then if those bacteria eat that glucose and lactulose, which will then produce more gas, and we can test that. If any of you guys do want to know more about the test especially, like I said, Dr. Bush is, I think, in Stillwater Natural Medicine, I think we're the only place in Minnesota that tests on site in Minnesota. But he has another company that just does SIBO testing and gut health, and it's the Neurovana. So if you guys want to check out anything more about the test, more about SIBO, more about the gut-brain connection, you can go to neurovana.com. So he has a great website there, and it's sort of his sister company when it comes to SIBO, but there's a great video there on how to collect. So I will have you guys look at that if you're interested. So one of the things and one of the reasons why it's so important with SIBO, and we're so passionate about really making sure that nobody goes undiagnosed with SIBO, is because it's hard to reach optimal health and wellness or to replenish the body if there is this infection in the small intestine. And one of the reasons is because I can't stress enough how much nutritional deficiencies come into play. So if there is an infection in that small intestine, and the small intestine can no longer function the way that it should, the number one thing that you're going to see is you're going to see nutritional deficiencies. And so these are going to be deficiencies in fat-soluble vitamins. So those are going to be your A, D, E, and K. And the other thing to remember is that it's really up to the bacteria in our gut, especially with vitamin K, to keep the levels the way that they should be, where they should be. So anytime we have an infection, we're going to have an imbalance of the good versus bad bacteria. And so what we want to do then is to make sure that we're also replenishing the person and getting them back to proper nutrition. And so the other thing that I think is interesting is vitamin D. Obviously, there's a lot of information now about vitamin D. Almost every practitioner talks about vitamin D, tests vitamin D levels, but it's so important with the gut. And whenever we have any kind of concern with vitamin D or with the gut, we will see deficiencies start to occur with vitamin D. And the reason why is that vitamin D sort of holds all of our cells in our digestive system and digestive tract together. They're sort of the rubber bands between a lot of these cells, especially in the small intestine. So if we have like a leaky gut, we are sort of then just causing that vitamin D to be removed quicker from our body. And obviously in this area, we see a lot of vitamin D deficiency. And so it's really important then that we all are doing our best to keep the vitamin D levels where they should be for optimal health and wellness. And another deficiency that we see a lot is vitamin B12. So when we talk about cobalamin or B12, we see this deficiency a lot because of sort of twofold. First of all, B12 is really dependent on the gut for absorption and the stomach. So we have one specific component of our stomach called intrinsic factor that's just about absorbing B12. If there's inflammation, then that intrinsic factor doesn't do everything it's supposed to, and B12 will be the first to sort of take a hit. It's impossible for us to methylate, for us to heal, for us to detox, and for our adrenals, our stress organs, to do what they need to do without the proper B12. So we also do a lot of support for B12. We do methylated and hydroxy B12 injections and things like that, especially for anybody who has chronic concerns, so that those levels can be at a state where they're actually optimal versus just getting by. And then the other thing that we do is we look to make sure then that we replenish the body. And those are some things that we do at Stillwater, including like the IV therapy and things like that to get people back up and running and get their support while we fix the gut and immune system and everything else. So we've talked about this a little bit, so I won't necessarily